afternoon, everybody. Even before we start, let me first thank all of you for coming out today and celebrating this afternoon with us. It's a great opportunity, and I think it's a great honor for us to spend some time with you. I'll introduce my team, my friends, my colleagues first, and then we'll go ahead with how the afternoon is going to roll further. So we have with us Dr. K.R. Balakrishnan. Dr. Bala is the chairman for the Heart and Lung Transplant Program at MGM Healthcare. One of the pioneers in cardiac surgeries and lung surgeries. I think under his belt, he has the maximum number of transplants that anybody has done in the country. And again, pediatric cardiac surgeries, valvular surgeries, you name it, and he has done it, starting from the simplest to the most complex of the surgeries that are known to mankind. We have Dr. Suresh with us, who is the head for critical care cardiac anesthesia and the co-director for the Heart and Lung Transplant Unit as well. Dr. Suresh has had a long journey with Dr. Bala, and I think this is one stellar team which has made all this work possible. We have Dr. Ravi Kumar with us. So Dr. Ravi Kumar is probably, I can take a stab at it and yes, say that he is the first transplant cardiologist into the country. He was the first cardiologist who dedicated his career into giving up angioplasties and angiographies and following up patients with heart failure, a branch which was not well known at the time when he started off, and helping them out towards transplant, towards advanced therapies, which can make a lot of difference in their life once medical therapy fails. Accompanying them is our newest member of the team, Dr. Deepika. So she is a consultant in transplant pulmonology and part of my team. I am Dr. Apar Jindal. I am the head of the lung transplant program and the chairman for the pulmonary services at MGM Healthcare. So me and Deepika, we work as a team. Along with us, it is a great privilege and honor to have two more dignified personalities with us. Dr. Merchant, who is again a senior consultant cardiologist based out of Bombay. So has a huge and vast experience of handling all sorts of cardiac issues, especially with special interest in heart failure. And of course, my dear friend, Dr. Sameer Gupta. So Sameer is at Metro Hospitals and at Unkal Hospitals, Delhi, and Gurgaon and Noida. And of course, he has been a big strength to the team. We work in a partnership, we work together, wherein we try to help most of the cases which are being treated by Sameer and his colleagues at Metro Hospitals. And whenever there is a need for a failure management, the MGM team comes into the picture and try to do the best for the patient. Having gone with the introductions, what is the need for this interaction that we have planned for today? So it's not just to highlight that we have done a huge number of cases. We have done more than 500 transplants when we talk about heart and lung transplants put together. We are one of the biggest programs, the top 1% program across the world and in Asian countries. The sole program in the country doing double digits of heart and lung transplants every month. But yes, more importantly, we want to highlight the importance of understanding what the patient goes through when the patient is suffering from a failing condition, whether it is a failing heart, whether it is a failing lung. It's not like an infection. It's not like any other disease because it is a slow process. It is an excruciating, it's a painful process that the patient will undergo not for a day, not for a week, but for months and for years together. And once they come to a point where medical therapy fails them, the only option available then is transplant. So how the patient goes through that how we can sensitize more and more people taking your examples. And it is so fortunate that so many of our patients are here today to support our endeavor. And it is their story that we want to popularize, that we want to spread across into the community and sensitize more patients who might need these kind of therapies, who can approach their doctors for this further. So we will talk a little bit we will present some cases, we will talk about a few cases, and also we will talk a little bit about organ donations. See, everything fails. Every transplant surgery would fail if there is no organ available. There is a good number of patients who are waiting, but there are not that many organs which are available. So how does one become an organ donor, why should one become an organ donor, and how we can help sensitize this information, how we can help promote this information, that more and more people should come forward in their time of grief to promote organ donation. We're going to talk about that. And then I think the major part of the meeting would be, we want our media colleagues to interact with our patients, listen to their stories directly from the patient's mouth, what they went through, how they went through, how the surgeries have helped them, how the treatment has helped them, and how they are doing well now, starting from a period of a few months to a period of decades. We have all ranges of patients available over here, and you can interact with them. So major part of the event would be a question and answer session. So to take it forward, I invite firstly Dr. K.R. Balakrishnan to talk about the program, and most importantly to talk about the importance of organ donation in the country. Dr. Bala.
Namaskar, thank you, good afternoon. Organ donation and cadaver transplants actually started in India in 1994. But till about a decade ago, there was not much progress. 10 साल तक organ donation ऐसा था कि mostly southern states में होता था. Or when an organ was available, there was no recipient. When there was a recipient, there was no organ donation. And distribution of organs was chaotic. So actually, Tamil Nadu was one of the first states which formally formalized this distribution of organs. So, 10 साल पहले ये journey शुरू हुआ when large number of heart transplants started. हमने शुरू किया था. And one of the reasons, as Dr. Apar Jindal mentioned for this meeting, is to highlight कि 10 साल में what have been the outcomes. So ये transplant उसी वक्त advise करते हैं जब और कोई चारा नहीं रहता, when the future is bleak, when the medical treatment has failed, and most of these patients did not even have a few months to live. तो उस मुकाम से अगर आप सोचेंगे तो हमने भी जब शुरू किया था ये जर्नी, हमें पता नहीं था कि ये कितने साल चलेगा ट्रांसप्लांट, क्योंकि हमें भी वर्ल्ड एक्सपीरियंस के बारे में मालूम था, मगर इंडिया में प्रॉब्लम्स अलग हैं. हाँ, यहाँ का हवा साफ नहीं है, यहाँ का पानी खराब है, यहाँ पर ट्यूबरकुलोसिस is common, infections are common. People live in rural areas, access to medical care is not good. Magar, we started this not knowing how this will pan out in terms of long-term outcomes. 10 साल, 15 साल, ये कितने साल तक ये normal हो सकते हैं. But one good thing happened is the internet revolution started around the same time. Our mobile phones and mobile internet became available, so follow-up became much easier. जब मैं 1990s and all that, follow-up was impossible. Not even phone calls were possible, as you know. So if somebody was in Sholapur or Bulandshahr or Ballabgarh or in some rural Assam, if they became sick, there was no way of contacting doctors, or we had no way of knowing what is happening. Immunosuppressive drugs were not available, and blood tests to monitor immunosuppression. Aajkal the labs come to your house, take the sample and send by WhatsApp the outcomes to everyone, so it's easy to treat. So things fell into place, or I'm very happy to say, in fact, Arora Sahab, he's completed over 10 years, and he came to us from Delhi, from the ICU in one of the major hospitals here. सब लोगों ने बताया था इनको चंद हफ्ते बचे हैं रहने में, और he's hale and hearty, back to normal. I still remember his wife and his son. They were waiting for a long time for an organ. So many of these patients are here, and we are actually surprised. We've also published this, that our 10 years survival rates are actually as good, if not better, than what is published internationally. तो मुझे ये जब हमने ये शुरू किया था, हमें ये पता नहीं था कि हमारे लॉन्ग टर्म रिजल्ट, ये रिजल्ट के बारे में अगर आप सोचोगे, there are two kinds of results. One is immediate outcomes, कि ऑपरेशन हुआ, सक्सेसफुल हुआ, घर चले गए. दूसरी बात, ये ट्रांसप्लांट में हमें सोचना पड़ेगा ये 10 साल 15 साल ये बिल्कुल नॉर्मल हो जाएंगे कि नहीं, और उसमें सर्जरी के अलावा बहुत से बाकी चीज़ें इम्पोर्टेंट हो जाती हैं. हाउ केयरफुली कैन फॉलो अप पेशेंट्स, हाउ केयरफुली द ड्रग लेवल्स कैन बी मॉनिटर्ड, लैब रिजल्ट्स, द पेशेंट अपने हार्ट का कितना ख्याल रखते हैं, एंड सो everything matters. So I'm very happy to, one of the reasons we are holding this is we now have 10-year outcomes of our transplants, and especially if they are come to us in good condition. Over 70% of these patients are doing normal at 10 years, which is actually even better than what is published in international literature. So आज के ज़माने में हम ये उम्मीद कर सकते हैं कि 20 से 25 साल तक ये नॉर्मल रहेंगे, और 25 साल अगर आपका उम्र है 50, कोई कम नहीं, और हर रोज़ तरक्कियाँ हो रही हैं, हर रोज़ नए इन्वेंशंस आ रहे हैं, हर रोज़ न्यू ड्रग्स आर कमिंग, सो दिस इज़ ओनली गोइंग टू इम्प्रूव. सो ये हमारा ये सोचना है कि ये जो इनको फ़ायदा हुआ है ये इसी कारण हुआ है क्योंकि और किसी इंसान ने अपने मरते वक्त अपना अंग दान किया है. सो दैट लार्ज हार्टेडनेस ऑफ अ डोनर शुड नॉट बी फॉरगॉटन. ऐसा कोई वजह है कि फॉर सम रीज़न इन नॉर्थन इंडिया ऑर्गन डोनेशंस आर नॉट एज कॉमन एज इज हैपनिंग इन द सदर्न पार्ट ऑफ इंडिया. हमारे यहाँ तो एक्चुअली एवरी डे वी हैव अ डोनर, वर्चुअली एवरी डे. इनफैक्ट इसकी वजह से हम महीने में लास्ट month we did 14 transplants. तो is to a large extent it is education and awareness, क्योंकि हम जब मर जाते हैं हमारे अंग किसी के काम नहीं आते, हम वो भी खास तौर पे हमारे समुदाय में हम तो जला देते हैं, तो उससे किसको क्या फ़ायदा होता है. अगर इसकी वजह से और कोई इंसान 15-20 साल नॉर्मल रह सके और अपने फैमिली के साथ ज़िंदगी बिता सके, उससे अच्छा दान क्या हो सकता है. तो हमारा ये अवेयरनेस क्रिएट करने का भी एक मकसद था ये मीटिंग होल्ड करने के लिए. बट इट इज़ ऑल्सो टू स्प्रेड होप दैट बिकॉज ऑफ द एक्सेलेंट आउटकम्स ऑफ ट्रांसप्लांट्स इंक्रीजिंगली मोर एंड मोर स्टेट गवर्नमेंट्स हैव स्टार्टेड फंडिंग. मुझे दिल्ली गवर्नमेंट के बारे में पता नहीं अगर ट्रांसप्लांट के लिए पैसा देते हैं कि नहीं. सर्टनली हमारे बहुत कर्नाटका, तमिलनाडु एंड आंध्र प्रदेश आते हैं हार्ट ट्रांसप्लांट के लिए आई थिंक 16 नहीं तो 17 लाख मिलता है, और लंग के लिए 22 से 25 लाख मिलता है. तो ये रकम कोई कम नहीं है, 15-16 लाख तो कोई. और हम एक ट्रस्ट चलाते हैं, कई लोग यहाँ पर हैं जिसको ट्रस्ट से पैदा हुआ होगा, क्योंकि हमारा ये मानना है कि कोई अगर फैमिली नहीं तो कोई इंसान मरते वक्त अपना अंग फ्री में देता है तो उसका लार्ज हार्टेडनेस हमें सब में बांटना चाहिए. तो हमारे पास जो भी आते हैं अगर पैसा उनके पास कम रहता है ना बिल्कुल भी नहीं रहता, हमने अपनी तरफ से पूरा मदद किया है. कई लोग हैं यहाँ पर जिनका ट्रांसप्लांट हुआ है, तो उसको दे कैन टेस्टिफाई टू दैट फैक्ट दैट वी हैव कंप्लीटली फंडेड सेवरल ऑपरेशंस. तो हम ये होप फैलाना चाहते हैं कि ये लंग और हार्ट के ऐसे डिजीज़ आज के ज़माने में हर एक डिजीज़ का ट्रीटमेंट है, और वो भी कोविड के टाइम पे बहुत से लोग एक्पो में शिफ्ट हुए थे, उसमें 50 से 60% को बिल्कुल ठीक हो कि वापस जा पाए और ट्रांसप्लांट भी हो चुका है. तो वी वांट टू स्प्रेड अवेयरनेस अबाउट द पॉसिबिलिटीज ऑफ टोटल ट्रीटमेंट एंड ऑल्सो द फैक्ट दैट अंगदान के बारे में हमें अवेयरनेस स्प्रेड करना चाहिए. और विद लार्ज पॉपुलेशंस हियर, if more and more people come to donate organs, lot more people can be saved. So this is the main message in this meeting. Thank you very much.
Going forward, next I would like to invite Dr. Suresh, who can tell us something about how the patient's journey goes forward, what advanced therapies are available that we can offer the patients before they go to the transplant, and the importance of early identification of these patients.
Yeah, good afternoon all. It's really a great moment to see our friends who had transplants few years back. Mr. Purushottam Arora, as Dr. Bala mentioned, finished 10 years. Then one of our youngest transplant, Sayam Sharma, nice to see you. And also our Parvati Devi ji, Gunjan, Raman Gandhi, Amit, Dua, Varnika. See, it's actually, and Jindal, who had heart and lung transplant. So it's really great. Some of them are getting married, and some of them are doing, great jobs. In fact, one of the patients from Delhi, he has participated in the Olympics also. So somebody has finished half marathon. So they are having a good quality of life. So they are inspiration to so many other heart failure patients. So if there is a end stage heart failure, there is a hope. And all of you should be inspiring personalities for those patients. And also when there is a end stage lung disease, again you have the option of lung transplant. And today is basically their day. I think the media can have interactions with them and write about them. And with these few words, I think, thank you.
So I think without us talking a lot more, I think I would invite some of the patients to come up and they can talk to you about them, how their journey was, how it started off with the problem, how finally the consultation came in, they underwent the transplant, and how the life has been after that. So I think the entire journey, starting from the issue till the solution and further on how it goes, is best told by the patients who've faced it. And sir is already standing up. Let me invite him to address you there.
Good afternoon. I'm Purushottam Arora from Delhi. I'm now 69 years old. 10 years back, I was heart transplanted by my godfathers, the entire team sitting out here. I welcome them first of all to our city of dreams in Delhi. A great welcome to all of them. And as Dr. Bala said, that I was really on deathbed. I was in Fortis escort in Delhi. It was like that. I used to come in the morning from the hospital, and again I was pushed back to the hospital in the evening. And I was totally given just a couple of days for time. But there was Dr. Apar, a very good doctor, and she was my moral booster. She every time consulted me and said that no worry, you will definitely get well. And she literally boosted me and she encouraged me a lot. I really have great praise for her. I would like to thank her for her good praises and help. And then when my son contacted the team in Chennai in Fortis Mallar, Dr. Bala sent Dr. Ram from Chennai to Delhi to take me to hospital in Mallar by air, and he put the drip on me and we went by the air. And on the third day after in the ICU, I was taken out of the hospital and I was told that go and wait in the hotel for a transplant. And on the fateful date, the lovely date, that is 21st of May 2013, on that very morning, my son had come to Delhi for a marriage in my family. And in the afternoon, I met Dr. Suresh in his chamber, and I was very much fed up. And I was literally crying, and I literally told him that let my son come, I will go back. I am not going to wait anymore. I am fed up. I don't want any transplant. I am unable. He consoled me, he helped me, but I said no. I came shouting and I came to the hotel. Throughout the day, I had been shouting at my wife that I am fed up. My wife, she is my moral booster, and she is my lovely partner. And she tolerated all my scoldings, but she had patience, and she also boosted me. No worry. Okay, let him come. And that very evening at 7 o'clock, I got a message from the hospital that I should come to the hospital for a transplant. And then when I reached the hospital, I was told for the attendants, my wives were there, and the team had said for the deposit. I'll tell you one great instance of a great gesture in the medical hospital line. My son was in Delhi. I had no money. No deposit was there in the hospital. And my wife told them that my son is not there, and the accounts people who don't have money to deposit. Dr. Suresh said, no worry, no need to deposit money, we'll take care of it. And they did the transplant. Here in Delhi, nobody will do anything even for a single rupee. And they did it for lakhs of rupees in that. And in the night, my wife was only there. And Dr. Bala, when he saw her, he told his staff to provide her a room, a bed in his own personal chamber and look after her throughout the night. They so great people. And as Dr. Bala said, for organ donation, I have already pledged my wife's body and organs, everything to the mankind for further afterwards. And I'm really grateful to this team, and I always pray for the God, to the God, that the donor who had donated his lovely heart to me, to his soul be rest in peace. And I'm really grateful to, and I once again thank all of you for giving me a very lovely young life. I'm very active. I work for 12 hours in a day. I used to tell Dr. Suresh, I will take a retired life after transplant. But I have become so young that now I work for 12 hours. That's all. Thank you.
Thank you so much for sharing that with us. And I think going on to the other side, we've heard a heart story. Let's also hear a lung story. So Nidhi, why don't you come up and talk to the, please, Vinay.
Good afternoon, I think it's 9. So, good afternoon everyone, and thanks to doctors, all the doctors that are here. It has been long since we have spoken on any public platform, so we would, apologize for any pauses that we're gonna take. And here's my wife. She has undergone a bilateral lung transplant under Dr. Apar for, I think it's more than a year, sir. On April 29th, I think we have been. So it's not it's a simple journey that we have had. So we got married 10 years back, 2012, and soon after marriage, I think after 2 years, we were started having an issue, like she cannot take a flight of stairs, and if we want to go somewhere, so breathing becomes very difficult for us to happen, and to lead a normal life that everyone must be living at that time. When you get married, you have dreams, and you want to run and see the places. That is not happening for us. So, and I think after 3 years we got conceived. We had a very beautiful baby, a girl. Her name is Anaisha. She is now 6 years old. So by the time my wife was pregnant, then again some issues pop up of the breathing. At that time we came to know about a disease which was I think CTD, ILD CTD, something like that. It was diagnosed. So we were on oxygen. Like it started with 2 liters per day, and it went on 10 and 15 liters even, and it was very difficult moment for us. And we came in contact with Dr. Apar. His team, when Dr. Apar has suggested us to go for a transplant, but we didn't took that time very seriously, because it was a very big decision for us to going for a transplant. We have exhausted like almost every opinion of the doctors that we might have come across, be it AIMS or any other institution, all the pulmonologists, even the rheumatologists, and I'm very sorry to say none of we were able to get a respite from any door. Wherever we go, there were a list of medications that been prescribed, and as Dr. Saab has said, there were no medication that were available in India, so we have got it some medication imported from US as well. But we were not able to continue a normal life. And then Dr. Apar's team suggested us to have a transplant. We were running on 2 liters oxygen at that time per day. Our requirement was very low. So since it was a very big decision, we were not able to make it. But then the situation gotten worse and worse. And so finally we came to that state where a lung transplant was imminent. We were not able to delay it further. So we went under him. It took some time, almost like 2 or 3 months. It was not an easy journey for us, but it happened. So now we are very grateful to the doctors who have come across to our life, and especially the ones who have treated us. And anything, I think it would be best if you have any question not from the doctor or medical side, if anyone wants to ask for our experience, I think that would be better rather than telling everything. And yes, Nidhi.
I'd just like to add one thing, that you have to be very strong willpower. I was like, I have a daughter, so let me avoid transplant till the time I can, because outcomes are always not that great. But then when my daughter said, no, I don't want mom to be on oxygen, I want you off oxygen. Other moms are off oxygen. For her it was like that time online classes. So she used to see other moms, normal and without oxygen. So that shook me, that motivated me, that even like with oxygen and on BiPAP, maybe, I would be not of any use to anyone. For her, she would be very sad to see me. So I made up my mind, and then Dr. Jindal really helped, counseled, he assured, and we just trusted him, and he said, come to Chennai, and I said, okay, we are coming. So I'm very thankful to him. It's a tough journey, but with willpower, with support of everyone, best doctors, my husband supported, and my daughter's motivation, and my parents. So I was able to come through. It's tough, but you can if you have the will. There has to be strong motivation. And I hope to live for as many as I can for my daughter to see her grow up. So that's my wish, and I want all of your wishes and blessings. Thank you so much. And thanks to Dr. Jindal.
And it gave us we were very motivated to listen to this gentleman saying that he has lived for 10 years. So we were hoping, because I think I still remember your words. You said she will live for another 5 plus something.
I think I am going to live for another 25 years.
Then you're going to give us some strength, because we are having
I'm now 69.
Yeah.
I'm not so big before I complete 90.
That's the thing. Thank you so much.
I think that is the spirit.
Yeah,
So it's just a number. So how many years somebody is going to live, nobody can say.
So for experience from our older people, I am young old.
I had a heart transplant. I was scared because of heart transplant, but my mom said nothing will happen. But I said, promise me, you will say everything that about the treatment. I will not lie. So she said, okay. Thank you, Dr. Bala and Dr. Suresh and Dr. Ravi.
Good afternoon, everyone. First of all, thank you so much for having us here. So as Sir said, it's a difficult decision, it's a long journey, and I completely agree. My son was 7 when he was diagnosed with cardiomyopathy, and the heart was just 20% in the working stage. We were referred to Dr. Bala by Dr. Balakrishnan here in Fortis, Okhla, and I guess that was a turning point. I had a word with Dr. Ravi, and he said, you please come down here. And again, a lot of apprehensions. Again, this is a very, very tough decision whether to go about it or not. So I would like to put it on record that as a parent, as a mother, obviously you leave no stone unturned. And we had to, sent our reports, his reports to Australia, Hong Kong, London, Singapore, US, everywhere. Spoke to a lot of doctors, but I guess 3 of the doctors clearly said, don't move out of your country, it's the COVID time, that was 2021. And everyone purposely said that, go meet Dr. Bala. So I'm sure, he'll be able to do wonders for you. So don't step out, and you have somebody great there. So that's the kind of recognition that he has, globally. So then I remember I went to Chennai. So I guess there are 3 different stages which are very important. First is the pre-transplant, wherein the attendants, the patient, everybody is in so much of pain that, it's very difficult. And I remember it was just 1 meeting away with Dr. Bala, and he just, he held him tight, and he said, as a mother, I'm sure you're worried, don't get worried. He'll be playing IPL one day. So that was quite a relief. And every word, I guess, coming from Dr. Bala was like a word coming from God. And it got so nicely registered in my mind, and I was, so comfortable after that, that, I was very sure that now my son will be all right. And that's when, again, he's telling me that, the kind of assurance. He said, Mama, you will not lie to me about anything. I remember, there were a lot of things, blood tests and, scans and everything. And for a child, 7-year-old child, it's very difficult to go through all the process. So he said that, please give me my time. And I must thank the entire team of MGM also there, the nurses, the entire staff, the laboratory people, they are so patient. They actually understand, what a patient is going through. That is very, very important. Because, as a family, we would understand what the family member as a patient is going through. But for the doctors, nurses, and everybody to understand this and feel that it's very important. So we felt that, that was coming from each one of them. Then, I guess the day when we, had to go for a transplant, I remember the entire night Dr. Bala was, he was kind of comforting me that everything will be all right, don't get worried. I still have to ask, sir, when do you sleep? I remember I was talking to him, I was talking to him till 4 o'clock in the morning, and 11 o'clock I see him so, energetic and enthusiastic and, all geared up to go for this transplant, and he said, we have a good heart, don't worry, he will be just all right, So that was one time it was got, over with. And I have another magical personality here, Dr. Suresh Rao. I don't know what is so magical about this person again. I have no words to explain and express my gratitude to each one. And Dr. Suresh, I guess, is been there since the time. It's been 1.5 years. I don't remember any message being unanswered or any reminder that has to be sent to him to answer my query. He's so available. Any wishes, any message to Dr. Bala, I think he doesn't take more than 3 minutes or 4 minutes. I have on record, so he'll reply to you. So there are 3 stages. What we say is pre-transplant, transplant and post-transplant, and I can just assure each one of you who is going to be a recipient here that you are in the safest hands in the entire world, I would like to say, because I had spoken to so many doctors globally and everybody said you have the best team. So no words to express them. And again, when we say this, that organ transplant is very important, I guess all those who've undergone this, the family also knows how painful it is to see the patient, see some family member going through the entire process. And we should definitely, I guess this is one of the biggest donations we can do. As rightly said that I still remember while my son Sam was not well, while I was praying, I used to wonder, what am I praying? I'm basically asking for somebody's death. So that is very tough, but then as a mother, that was something I could do. I could pray for this. So that's all. I guess we must go for some transplant, this organ donation, because that is something that will give a new ray of hope and life to somebody. And again, sir, thank you so much. Thank you. And I will definitely love to see him playing IPL, and we all sitting in the audience. Thank you so much. Thank you, Dr. Ravi. You've been a great help also. Thank you, and all the best to each one of us. It's not just a journey of a patient, it's the entire family. And we have an extended family here who's always there to take care of us. So we will live happily and healthy. Thank you so much.
I'm Dr. Ravi Kumar. Any other for experience we can... Raman, बोलना चाहेंगे ना? Raman is a very unique case. He is one of the very sick patients who was very sick in Delhi. Then in a very emergency situation, यहाँ शिफ्ट करना पड़ा उनको. उसके बाद हमको भी पता नहीं था उनका क्या होगा. तो काफी लकीली गॉड्स ग्रेस से इम्प्रूव हो गए.
Good afternoon all. Thank you so much, Dr. Bala. आज
हेलो. आज ही के दिन मेरे हस्बैंड 40s में थे. आज पूरा कंप्लीट 1 ईयर हो गया. आज ही के दिन हम 40s गए थे. एक नॉर्मल हार्ट अटैक हुआ था. सिंपली हम लेकर गए. देन 40s में हमें बताया कि इनकी बहुत ही क्रिटिकल सिचुएशन है. तो एक हार्ट में क्लॉट है, बाईपास करनी होगी. हमने सोचा नॉर्मल बाईपास सर्जरी करनी है, देन सब ठीक हो जाएगा. 40s में बाईपास सर्जरी हुई 8 जून को ही. कंप्लीट 8 जून हो गया. आज कल 9 जून है, मेरे हस्बैंड का बर्थडे है. तो 8 जून को बाईपास सर्जरी कर दी. देन उन्होंने हमें बोला कि अब इनको एक्मो पे रखना पड़ेगा. अब हमें तो नहीं पता था कि एक्मो क्या चीज़ है. तो स्टेप बाय स्टेप दिन वहाँ पर बीतते रहे. 10 दिन से एक्मो पर रख दिया. फिर लास्ट में उन्होंने बोला कि हम आपको हार्ट ट्रांसप्लांट के लिए रेफ़र करेंगे. तो उन्होंने हमें MGM के लिए बताया, डॉक्टर बाला के लिए बताया, डॉक्टर सुरेश राव सर के लिए बताया, जो कि हमारे लिए एक भगवान, बहुत, मैं इनको लाइफ में कभी नहीं, इतनी क्रिटिकल सिचुएशन मेरे हस्बैंड की इन्होंने स्टेबल करके दी है, जो कि हमें लगा था कि अब हमारे हाथ से चले गए। और हम इनसे मिलने गए आफ्टर ट्रांसप्लांट, तो जब बिल्कुल ठीक हो गया हम इनसे मिलने गए तो इन्होंने हमें बताया कि हम मतलब ऐसे इनको भगवान से हम इनको छीन कर लाए हैं, तो इट मीन्स ये हमारे लिए भी एक बहुत बड़े भगवान है। थैंक यू सो मच डॉक्टर बाला, थैंक यू सो मच डॉक्टर सुरेश राव, पूरी टीम, पूरा स्टाफ, इतना हेल्पफुल, इतना कोऑपरेटिव। थैंक यू सो मच MGM हॉस्पिटल फॉर ऑल MGM।
In this journey, I mean, we have done for around 500 heart transplants. And for people who are experienced in this cardiology line, heart transplant comes in the end. So suppose you talk to 10 cardiologists here, so they have many other treatments available. For example, Parvati, she was one of the older patients, 2014 or 15, so referred by my friend Dr. Mantri. So for her it was like advanced heart failure. The heart problem is not improving. So after one level, then the cardiologist feels that now I cannot do anything. So you go for transplants. But yes, cardiologist has that belief in the team, in Dr. Bala or the team. So then now she's fine. And it needs, of course, a lot of post-operative close monitoring and scientific. Dinesh is the son.
मम्मी का ट्रांसप्लांट 2015 में हुआ था, 8 साल हो चुके हैं, और बहुत नेगेटिव थे, बहुत पॉजिटिव भी थे हम, कि बहुत रिश्तेदारों ने बोला कि कोई फ़ायदा नहीं है, एज हो चुका है, लेकिन हमारी तो माँ है। हमने 4 महीने रहे हम वहाँ पे, और बहुत इतना अच्छा प्यार मिला, डॉक्टर इतने अच्छे हैं। मेरे पापा है नहीं, यही मेरे लिए मेरे बाप है, मेरे भगवान है। उन्होंने बहुत अच्छा ट्रीटमेंट किया, और मम्मी बिल्कुल ठीक है, मम्मी बिल्कुल ठीक है। मैं, मेरी वाइफ, मेरा बेटा हरमन आज 13 साल का हो चुका है, जब वो 5 साल का था। हम जब उसकी पढ़ाई वढ़ाई सब छोड़ के यहाँ पे आ गए थे, हम 4 महीने रहे, और बहुत, मम्मी बहुत ठीक हैं, और 8 साल हो गए मम्मी को। और आ जाओ पर
नमस्कार, मैं डॉक्टर बाला, डॉक्टर पूरी टीम का बहुत दिल से शुक्रिया अदा करना चाहती हूँ। मेरी ज़िंदगी इन्होंने दी है।
Here, also it's very important in this field that although the surgery and the pre-surgery part, critical part is important, same time the post-operative part and follow-up for a long time, especially in a country like India. Because it's not United States where everything is set. So in this connection, I would like to especially thank Dr. Sameer Gupta and Dr. Shahid Merchant, who are our partner cardiologists. They are working in 2 different cities. So Dr. Sameer is in Delhi, so he's also vice chairman of Metro Hospital. So he actually also helps us for following up all patients in Delhi. Same way Dr. Merchant in Mumbai. So the follow-up of patients are extremely important in transplant because it is not one-day affair. So after that, so many problems, potential problems can be seen by the physician and which can be blocked or contracted. So that is the physician's role. So Dr. Sameer, would you like to say? Just your general experience.
Thank you, Dr. Ravi. My name is Dr. Sameer Gupta. I'm a cardiologist in Delhi. I am the head of cardiology for the Metro Hospital and also at MP Heart Clinic in GK and Umkal Hospital in Gurgaon. So I was initially associated with the team with Dr. Balakrishnan, Dr. Ravi, Dr. Rao through chance. It was just through a patient and through other network we got associated. And the work that they're doing is absolutely fantastic and phenomenal. I was exposed to a lot of heart transplants when I was in the US and I was living there and working there. And when I came back to India, it was not much was available. All these end-stage heart failure patients, they would just be on medical therapy. There are other therapies available, but those are not very well versed in India, like LVAD and they're very expensive and stuff like that. But transplant was a big option over there. And when I came to India and I was exposed to this, the cutting edge work that they're doing, it was actually fantastic and phenomenal and very inspirational for a young doctor like me as well, to be associated with them, to learn from them, to share knowledge, ideas and experiences. And I think it's very important for all of us over here who are either recipients or potential recipients or friends from the media, that that you've heard all these stories today, that transplant is a very viable option for patients. The only challenge is there are not enough donors available. So it's very important that all of us spread the message of donation. Many years ago my mother had told me, she's like, beta, jab main jaungi na, meri body ko zara, meri aankhon ko, mere heart ko, mere cyst ko kahin donate kar dena. Let it be used for somebody else. Like the sir over here before said, I thank the person who gave his heart to me. And that is fantastic, right? Just imagine that father or that mother, whoever is here, is somewhere around the world, they know mere bacche ka dil kisi ke aur ke dil mein dhadak raha hai. It's so comforting for them. So I think that's very important that we spread the message, and congratulations to everybody over here, Apar, Dr. Rao, Dr. Balakrishnan, Ravi, for the phenomenal work that everybody is doing as a team. Thank you.
And Merchant, any like to say a few words before we go for some patient experience?
So thank you, Dr. Bala, Dr. Ravi, and the whole Suresh Rao for inviting me. I'm from Lilavati Hospital, Mumbai. I'm the founder member of the hospital, and I have been associated with Dr. Bala from 35 years, because we studied in KM Hospital, worked in CVTS. So even at that time, I'm talking of 35 years ago, I used to look upon Dr. Bala as a genius, because he was above all of us during his MCH days in cardiac surgery. So I'm very happy to be here today. We are established an advanced heart failure clinic at Lilavati Hospital, and we are also running heart failure clinics in Mumbai. And I thank MGM Healthcare and the team of associating us and Mumbai patients with advanced heart failure who travel to MGM Healthcare for their heart transplant and many times a WAD program. Thank you very much, the team, and I'm very proud to be part of the MGM Healthcare. Thank you.
Yeah, so Varnika, would you like to add something of your experience?
Hi, I'm Varnika and I'm 17. I got my transplant in 2020 when I was 14 years old. Yeah, I think my mom would tell you my story a bit better.
Hello everyone. It's little, when you come here, like he could not speak. मेरे से भी थोड़ा सा अभी हो रहा है कि चीज़ें याद आती हैं आपको, जर्नी याद आती है, and काफ़ी लोग उस जर्नी से गुजर चुके हैं. I can really relate to you. She was 6 years when we got to know she had a cardiac myopathy. जब first time 6 साल की थी ये 2011 में, और बिल्कुल ठीक ठाक थी, नॉर्मल लाइफ जी थी, और 3-4 दिन में इसकी हालत ऐसी हो गई कि हार्ट फेलियर, मतलब वो जो हुआ, हमें नहीं पता था तब तक कि हार्ट फेलियर है या इसको कोई हार्ट प्रॉब्लम है. एंड हमने डॉक्टर राधाकृष्णन को ही दिखाया था तब यहाँ पे. तो उन्होंने हम इसको रात को लेके गए 8-9 बजे. तो उन्होंने कहा हम कुछ कह नहीं सकते, सो वो वर्ड्स मुझे आज तक पूछते हैं, क्योंकि वो आपने कहावत सुनी है ना, पैरों के नीचे ज़मीन खिसक गई, वो वाला फीलिंग उस टाइम आपको लग रहा था कि मेरे को बच्चे, आई हैव ट्विंस, सो आई हैड देम विद लॉट ऑफ एफर्ट 8 साल बाद. सो आपको दिमाग में ये आ रहा है कि भगवान, यू कांट डू दिस टू मी नाउ. So anyways, Dr. Balakrishnan did his best. उन्होंने इसको ट्रीटमेंट शुरू किया. She was breathless and by the morning she was stable. Heart function was just 5-10% that time and still we didn't know what's going to happen next. उन्होंने कुछ ट्रीटमेंट्स दिए. उन्होंने बताया हमको कि ये सब होता है. हमें कुछ नहीं मालूम था तब तक. आई एम श्योर जो भी आप लोगों ने देखा है एक्मो का नाम, ये सब चीज़ें जाके तो चेन्नई में सुनी है, तब तक हमें कुछ मालूम ही नहीं था. बिकॉज जब तक हम फेस नहीं करते वी डोंट नो उन चीज़ों के बारे में. फिर वो उसको रिवाइव किया. 20% पे हार्ट आया, फ्रैक्शन आया. फिर डिस्चार्ज हुई. पूरा साल वो घर पे थी. उसके बाद धीरे धीरे स्कूल वापस जाना शुरू किया एंड लाइफ नॉर्मल होने शुरू हुई. स्लोली एंड ग्रेजुअली शी केम बैक टू 50%. 2015 में अगेन उसका ड्रॉप हुआ, फेलियर हुआ, बट सिम्टम्स नहीं आए. सो वी डिडंट नो. हम नॉर्मल चेकअप के लिए गए और पता चला 32% पे आ गया वापस एंड देयर वाज नो सिम्टम. अगेन उन्होंने ट्रीटमेंट किया. अगेन शी केम बैक. फिर नॉर्मल हुई. पर 2020 में जैसे ही लॉकडाउन लगा, जैसे हमारी ज़िंदगी को लॉकडाउन लग गया, इट वाज लाइक बैड. लॉकडाउन है, हम डॉक्टर के पास जा नहीं सकते. दिल्ली बॉर्डर्स बंद है. वी आर स्टेइंग इन गुड़गांव एंड वी कुड नॉट मूव आउट. और उस बच्चे को लेके हम बैठे, हमें नहीं पता हमें क्या करना है. फ़ोन पे जितना हम कर सकते हैं. सिंस मार्च टिल अगस्त वो हार्ट फेलियर जो होता रहा, it went down to 35. Every week it was going down and we didn't know what to do. We went to all the doctors again. हम रात को इसको हॉस्पिटल ले जा रहे हैं. She cannot breathe, सांस नहीं आ रहा है. उसको स्टेबल करते हैं, फिर सब वापस लेके आते हैं. सुबह कभी 4 बजे, कभी 6 बजे. फिर 2 दिन बाद फिर रात को पूरी रात सो नहीं पा रही, आंखें बंद नहीं हो रही. थिंग्स वेंट बैड, रियल बैड. आप सोच भी नहीं सकते. और स्वेलिंग शुरू हो गई. लास्ट हमने इसको मैदानता में एडमिट किया. फिर अपोलो में सब ने हमें बोल दिया कि ट्रांसप्लांट ही करना पड़ेगा. देयर इज़ नथिंग लेफ्ट नाउ. राधाकृष्णन जी के पास भी गए. उन्होंने दोबारा MRI किया. सब कुछ बोला. ही सेड दिस इज एंड ऑफ रोड. फिर मैदानता में दे टोल्ड अस दैट वी शुड गो टू डॉक्टर वाला एंड शी वॉज इन अपोलो एंड नथिंग वॉज हैपनिंग. वी जस्ट कॉल्ड डॉक्टर बाला. कॉन्फ्रेंस कॉल में हमने उनसे बात करी. माई हस्बैंड वॉज टॉकिंग टू हिम एंड ही सेड जस्ट ब्रिंग हर हियर. इज शी ऑन एनी सपोर्ट सिस्टम? वी सेड नहीं, अभी तक कुछ नहीं है, बट दे आर सेइंग नाउ विल पुट हर ऑन वेंटिलेटर बिकॉज ब्रीदिंग इशू बहुत ज़्यादा हो रहा था. ही सेड यू ब्रिंग हर हियर. एयरलिफ्ट करके लाना है. और ये सारी बातें हमें नहीं पता है. एयरलिफ्ट होता है, क्या होता है, यू नो इट्स लाइक व्हाट्स हैपनिंग, आपको कुछ पता नहीं है एंड यू आर जस्ट गोइंग विद द फ्लो. आई सेड मैं वेंटिलेटर पे नहीं लगाऊंगी. आई डोंट नो व्हाई. बिकॉज माइंड में था वेंटिलेटर में जो जाएगा वो वापस नहीं आएगा. सो इट वॉज क्रेजी टू डिसाइड कि क्या करना है. चेन्नई कैसे जाएं, मेरा बेटा यहाँ है, मेरी मदर इन लॉ है, किनको अकेला कैसे छोड़ के जाएं. एंड जस्ट हमने बात करी. शाम को 5 बजे इन लोग की बात हुई. वी डिसाइडेड फ्रॉम हॉस्पिटल ओनली वी वेंट टू द एयरपोर्ट. मैंने अपने सिस्टर बुलाया, वहीं से सामान पैक होके आया एंड वी एयरलिफ्टेड हर टू चेन्नई. 18 सितंबर रात को हम हॉस्पिटल पहुँचे एंड उसके बाद यू नो इट वॉज जस्ट गोइंग ऑन. 2 days लेटर वीकेंड पड़ गया था. शी वॉज ऑन मेडिकेशन इन ICU. मंडे दे चेक्ड हर बिकॉज शी हैड अ सीजर अटैक रात को 2-2:30 बजे एंड वी वर लाइक पता नहीं क्या हुआ है. फिर मॉर्निंग में डॉक्टर सुरेश राव ने आके बोला वी हैव टू पुट हर ऑन बायोवैक टिल वी गेट अ डोनर. सो वी हैव टू ब्रिज बिटवीन हर सर्वाइवल. ट्रांसप्लांट होने तक उसको रखना है. हार्ट काम नहीं कर रहा है. What do you say? We were trusting them. We left everything on them कि आपको जो ठीक लगता है आप करो. So 2 दिन बाद ही उसका बायोवेट लगा, ओपन हार्ट हो गया. एंड माई थिंग वॉज कि अभी एक बार सर्जरी हो रही है, फिर दोबारा होनी है. और मैं गॉड को प्रे करूँ कि इसी में ठीक हो जाए, दोबारा ना हो. सो यू नो एज अ मदर आप नहीं चाहते, चाहे वाइफ हो चाहे मदर हो, कि दोबारा ये चीज़ें आप नहीं देखना चाहते. 3.5 महीने हम भी वहाँ थे. शी वॉज इन हॉस्पिटल फॉर ऑलमोस्ट 3 months. एंड व्हेन वी टॉक अबाउट द टीम, आप सब बोल चुके हैं. दे हैव हर्ड इट सो मेनी टाइम्स. आई डोंट वांट टू कीप रिपीटिंग, बट आई हैव नेवर सीन एनीबडी लाइक दैट. इन नॉर्थ मैं यहीं आई हैव बॉर्न हियर, आई ब्रॉट अप हियर, बट जो एक्सपीरियंस हमें चेन्नई में हुआ है, डॉक्टर्स का, पूरी टीम का, पूरे हॉस्पिटल का, I mean, whether it was exactly like sisters हैं, चाहे वहाँ का staff है, admin staff है, even the CEO, Mr. Harish is not here today. Everybody, I mean, it was like a family. लग ही नहीं रहा था कि हम अकेले हैं जान शहर में, हम हॉस्पिटल में ही रहते 4 महीने, 3.5 महीने, वहाँ वेटिंग रूम में ही सोते थे, वहीं रहते थे, बिकॉज छोड़ने की हिम्मत नहीं थी. एंड एवरी डे वी यूज्ड टू वेट फॉर देम टू कम एंड आस्क देम इज शी ऑलराइट, वो ठीक है, वो सो रही है, वो जाग रही है, बिकॉज वो पहले बायोवेट पे थी और बाय गॉड्स ग्रेस 10 दिन बाद डोनर मिला. वी गॉट अ हार्ट. आई मस्ट शेयर दैट ऑल्सो. जब हार्ट मिला तो इट केम फ्रॉम सूरत एंड वी गॉट टू नो दैट बिकॉज शी वॉज क्रिटिकल. ये डायलिसिस पे भी थी, ये एक्मो पे भी थी और ये वेंटिलेटर पे भी थी. सारे बॉडी ऑर्गन्स जा चुके थे. सो दे फॉट फॉर दैट ऑर्गन कि वो वर्णिका को मिले, बिकॉज इससे 2 जो पहले वेटिंग में थे, तो दे वर फाइटिंग कि वो ऑर्गन वर्णिका को मिले, बिकॉज हाउ लॉन्ग शी इज गोइंग टू बी ऑन मशीन्स एंड बायोवेट लगा हुआ है. एंड वी वर लाइक, आई कैन नॉट बी ग्रेटफुल इनफ. But only thing which got stuck was when we got the donor and we had to sign the form. You remember, sir? And I was like, वो थोड़ा सा I think hypertension patient था. So I said, बच्चा छोटा है, I don't know कि should I take it or not, and I have no option. और हम बैठे हैं और वो फॉर्म साइन करना है and they all are standing waiting कि आप साइन करो तो हम उसको लेके जाएं. फिर हमने डॉक्टर बाला को कॉल किया. I said my husband will ask him. We called him. He said please go ahead. बस उनके वर्ड सुन के I signed the form कांपते हुए हाथों से किया था, but I had no option. And today she is here, all healthy and fine. She is leading a normal life. Yes, there were a lot of things because इतना कुछ हो चुका था तो recovery में time लगा उसको. But she is fine now completely. And she has passed her school 12th grade, अभी ख़त्म किया, college जाएगी. And it's a big thing, you know, it's a big achievement. Nidhi, I can understand your concern also. But I would just suggest कि don't think about future now. जो time है, just live it. Because you can't do much about it. है ना? So we have to live with this. जो भी time है, आता है दिमाग में, मतलब I cannot forget Chennai journey. But the kind of love and affection you see there, it made it much easier for you to be there. दो मैं भी सारा दिन रोती रहती थी, प्रेयर करती रहती थी, इन लोग को परेशान करती रहती थी. और अभी भी as you said, any message you send them, reports भेजो, चाहे कोई भी concern भेजो, you get the reply immediately. कोई भी hour हो. Initially जब वापस आए थे, कुछ थोड़ा बहुत हमें problems आए थे, तो आप हर छोटी चीज़ के लिए भी डरते हो. क्या करना है, पेट दर्द हो रहा है, क्या करना है, ये करना है. तो अभी भी हम पूछते हैं, तो वी गेट द रिस्पॉन्स इमीडिएटली. चाहे अगर इवन इफ आई डोंट वांट टू वेट फॉर अ रिस्पॉन्स, आई कॉल देम एंड आई एम श्योर दे, आई हैव नॉट एक्सपीरियंस दैट दे हैव नॉट पिक्ड अप द फोन. सो इट्स बीन अ great help and great journey, and I really cannot thank you enough, all of you. Dr. Jindal has been there for looking after her lungs, of course, I should not forget that. And Dr. Sameer, we will be definitely getting in touch with you because we are in Gurgaon now. So, but I'm sure, I think सब transplant patients हैं यहाँ पे, सबकी अपनी journey रही है. We have also gone through that big hell, but I think now it's just that we keep praying for a healthy, happy life throughout. जब तक जितनी भी है ज़िंदगी, वो तो किसी की भी पता नहीं है. And yes, I really want us to get together for the awareness program. North में नहीं है, North में actually donors नहीं. And when we were here, सब जगह से we went to Sabdajan, we went to Ames, we went everywhere. They said, don't even come. सब बंद है. और donors है ही नहीं because COVID, peak COVID था. उस टाइम वहाँ MGM में भी पूरे lungs patients भरे हुए थे. You remember Dr. Jindal? Post COVID. For transplant, मतलब I say God bless everyone, but it was hell that time, and these people were on their feet day and night. We have seen, I mean, in my ICU there were 11 patients. This was I think 2 या 3 heart के थे, बाकी सारे lungs के थे. So I used to see them and I used to just pray भगवान सबको हेल्दी रखे. So it's difficult to get out of that is a miracle, and Dr. Balakrishnan के words हैं. इन सब के लिए भी ये था कि it's a miracle that you know what has happened with her, और ये सब हो गया, transplant हो गया. Revive करने में time लगा, but then she revived, and then she revived very fast. फिर हम मतलब you know you forget about those things. But yes, we enjoy her hallucination talks. तो उसको उस टाइम जो मेडिसिन चल रही थी तो इसकी इतनी सारी hallucinations हैं जो ये बताती रहती है और हंसती रहती है खुद भी. इसको इतनी हंसी आती है सोच के, और हम सोचते रहते हैं कि क्या थॉट प्रोसेस चलता है, वो उसको बच्चे को भी नहीं पता, बच्चे तो छोटे उनको मालूम भी नहीं है उसके साथ क्या हो रहा है, उसको ये भी नहीं पता. जब ये BMT में ट्रांसफर हुई थी फ्रॉम द ICU, then we told her कि आपका ट्रांसप्लांट हुआ है. Till then and she's saying ट्रांसप्लांट क्या होता है, and I'm like okay आप कैसे बताएं बच्चे को कि डरे नहीं वो कि क्या हुआ है मेरे साथ. But then she took it well, और yes will power is very important. It is. अगर हम हिम्मत छोड़ देंगे, अब ये तो बच्चा है ना, but being a elder you have to be strong. तो उसको तो पता ही नहीं क्या हो रहा है, ठीक है हो रहा है, तकलीफ हो रही है, वो बता भी नहीं सकती है बिकॉज वेंटिलेटर है, ट्रिक्योस्टमी लगी, बिकॉज एवरी टाइम एवरी स्टेज अब ये ठीक हो जाएगी, अब ये निकल जाएगा, बट वी वर लाइक अब नेक्स्ट क्या टिल शी गॉट आउट द ICU. So I would just say God is there and these are God sent people. भगवान के भेजे हुए हैं. So I would really thank to you all again, and please keep up the good work and God bless you with long healthy life so that you are there for more people. Thank you. And but we should do a awareness program together. Yeah? Thank you sir.